Hello everyone, let's discuss about the differences between PCOD and complete Hydatidiform mole. So basically in PCOD, what do you need to remember for FMGE exam perspective is the Rotterdam criteria, which basically says that at least one of the ovary of the patient should have at least 12 follicles. More than that would be possible, but at least 12 follicles, which should be in 2 to 9 mm of diameter or size, you can say. And or. It means either of these criteria should be present for the patient to diagnose as PCOD, or both two can also be present. So the second criteria is the increased ovarian volume. So ovary will appear larger than its normal size. What is the increase in the volume? That is more than 10 cubic centimeter, and it goes for at least one ovary. So if either of the ovary shows either of these characters, we can diagnose the patient as PCOD. On the contrary, for complete Hydatidiform mole, the important thing we need to remember is that the egg with no genetic material fuses with one or two sperm. Okay, the one important point. Secondly, important point on the basis of diagnosis is that we can see the markedly elevated serum HCG level. So whenever the question said that markedly elevated serum HCG level, one of the point you can consider is complete Hydatidiform mole. Now comes the most important point, which is the USG finding of these two. First, the PCOD shows string of pearl appearance. As you can see here in the diagram, in the USG finding, that the pearls-like appearance is here, and they are arranged in like series manner. So it forms a string of pearls appearance, okay, as if pearls are beaded in a string. On the contrary, for the mole, we have USG findings of snowstorm appearance. One word also suggests. Here you can see the small thingy, which is like snow ka storm. Okay, so you have to remember it like snowstorm. And then we also say it as a bunch of grapes. Complains to you that she is discharging grapes like tissues. Okay, grapes like cluster of tissues. So then you will doubt that patient might have this mole. Okay, that's all. Thank you for watching.